Welcome, everyone. Thanks for joining us on another wellness webinar. We're so happy you're here. We have an exciting topic today, and as people are joining in, I just want to, for those of you who haven't joined us before, we're the Academy of Integrative Health and Medicine, and we're a global interprofessional integrative health association working to transform healthcare, body, mind, spirit, community, and planet. And so please also know that we record all of our webinars and put them on our YouTube AIHM Global channel, so you can always check those out if you missed the webinars live. We have some special guests introduced today. We have Dr. Sylvie Shuttleworth, who earned her PhD in clinical psychology from the California School of Professional Psychology in San Diego, California. She's a full professor within health psychology for the School of Naturopathic Medicine and the Department Chair for Counseling and Health Psychology Department at Bastyr University. Served as therapist at San Diego State University, University of San Diego, and Preuss School at the University of California, San Diego. She's published in the areas of attachment style, coping strategies, healthy relationships, ethical and legal issues, motivational interviewing, and supervisory experience. So welcome, we're so glad you're here. And we also have Dr. Baljit Khamba joining, who completed her Honors Bachelor of Science degree at York University, a Master in Public Health at Lakehead University, and her Doctor of Naturopathic Medicine degree from the Canadian College of Naturopathic Medicine. She teaches students the clinical applications of evidence-based practices within integrative medicine at Bastyr University within the naturopathic medicine and Master of Counseling Psychology programs. She's a licensed naturopathic doctor in California and Ontario, Canada, who has an avid interest in research, particularly as it relates to mental health, wellness, and nutrition. So thank you so much for joining, and I'll turn it over to you.
Well, thank you. Thank you very much for that. I'm really happy to be here, and we're eager to talk to you guys a little bit about gut microbiotica and mental wellness. But I'll let my colleague, Dr. Shuttleworth, begin. But I'll put up my screen here so that you can see a bit about us. So we're from Bastyr, California, as mentioned, and we're going to be discussing a little bit more about how we can optimize the gut-brain connection. So I'll let Dr. Shuttleworth take it away, and then I'll continue on from there.
Thank you. Next slide, please, Dr. Khamba. You can go one more. Wonderful. So if you go back just one slide, Dr. Khamba, and we look at this question, is there actually a very high incidence of mental health problems within our communities? I think if we were to have everyone write in the chat right now, there'd be a resounding yes. Of course there is. That's well documented. We know that, and particularly during the climate that we're living in right now, in this pandemic world, we've seen an increase in mental health concerns. But a question that sometimes I'll pose to individuals when I'm speaking about mental health concerns is we are quick to say yes, but I think sometimes we neglect to see the depth and the frequency and the prevalence. So if I can share with you all, the World Health Organization has done quite a bit of research to truly understand how predominant is this, how deeply does this go, and it's so disheartening, and it really, I have to admit, sometimes when I think about it, it brings me to tears. How prevalent this is. I think in terms of getting the ear and the interest of those who have a heavy hand in making decisions within our communities, politicians, government officials, it helps to put a dollar sign to this, so they understand the financial impact this is having on our economy. And what we've found when you look globally, from the research that the World Health Organization has done, in US dollars, we're looking at the mental health fiscal impact being $1 trillion every year. Now, if we look at an individual's inability to reach their full potential because of mental health concerns, and we take into account their potential income, for example, and growth in income, we are then looking at $2.5 trillion a year. So those numbers are staggering. On top of that, it's unfortunate, and I think there is still quite a bit of stigma around mental health concerns. This is the #1 disability. So if you look at across all disabilities and financial impact of disabilities, lost time from work, mental health concerns are the #1 disability. Some have even put statistics out that if you combine all the other disabilities, mental health might still be higher than all others combined. So if we go to the next slide. Frequency and what are we looking at? And I have to tell you that these numbers are probably conservative because these are those that we can actually identify, diagnose. They've come in, we've seen them. So we do have to wonder about how many individuals are out there that are not being seen where we can do a full assessment and diagnosis. The first numbers that I'll give you, this is really quite, let me start off with children and adolescents. So here we're going to look at any individual up until the age of 18. And what you're going to find is that in that, if we do a lifetime prevalence from birth until the age of 18, we're going to find that 1 in 2 children will meet the full criteria, DSM-5 criteria for a mental health disorder. So we're not talking about features, we're doing full criteria here. That's half of kids. It's outside the scope of this talk, but if we start looking at how many of those kids are actually receiving treatment, it's really quite unfortunate that we have a very small percentage of them being treated for their mental health concerns. I think part of that is lack of resources, accessibility to resources, having it normalized within their cultural groups, and in addition, the stigma related to that. Now that I've said that, we've got 1 in 2 of these kids that are struggling with mental health disorders. And if you can go back, thanks, Dr. Khamba. And we look at that and we know that some of them aren't getting treated. The majority of them are not getting treated. That helps us to understand this next number that I'll share with you. Now, this is looking at a 1-year prevalence, and we are looking in the United States, a 1-year prevalence. Now we're going over the age of 18. Of any individual. Now, I'm just looking down and I see, there are about 40 of us sitting right now on this call. And the reality is that this year, 10 of us will meet criteria for a mental health disorder. So we're looking at about 25% of adult Americans in any given year will meet criteria for a mental health disorder. And unfortunately, many of those also being untreated. And I think if I was to say, do you know anyone right now in your life? We would have pretty much every single person in this room raising their hands. So this is a long-winded way for me to make a case that more attention, more research needs to be done towards this. It's a loaded term, but what I will call an epidemic in our world. If you could go to the next slide. So we've got 25% of adults in any given year, and half of children throughout their childhood experience will meet that full criteria. Next slide, please. So, and this is so wonderful because here I am presenting to a group of individuals who are obviously passionate about integrative care. And I do want to say, I want to acknowledge, I feel very honored. I feel very privileged to have an audience that's willing to hear what we have to share, because even if nothing else comes of the research you hear today or the data that we share with you or what we're hoping to prove, maybe it changes your perspective or your lens or your approach to yourself or maybe a loved one in your life to bring you increased inner peace. Self-love and love for each other. Maybe there's something you'll hear today that will make someone's own well-being have a higher quality of life. So with that being said, I think it's a tricky environment that we live in, that many times when we're looking at really any condition, I mean, I'm talking about mental health right now, but if we look at any condition, the common cold, the headache, whatever it is, there is a tendency to look at it from a one-dimensional model or perspective. I think there's wonderful movement being done there. But I do think that even if we say we're integrative or holistic, biopsychosocial, there's still a pull to look at one particular lens. So a biological explanation, really looking at heredity, genetics, neurotransmitters, psychological explanations, looking at one's psyche, their thought patterns, behavioral things you may see, social implications and explanations. Here we'll be looking more at from a family systems perspective, and then sociocultural, looking at our community, our environment, our society, and how is that impacting what we may be seeing in terms of how someone is doing mentally or physically, their overall well-being. Next slide, please. So when we do this more one-dimensional model of mental disorders, or really any medical condition or healthcare condition, it's oversimplistic. But I think on an unconscious level, we really like that because it makes us, it's an easier way to draw lines and set up research projects. And even we have to, as we talk about our own research today, it's a challenge. Once you start to try to put in too many variables, it gets very messy, it gets very complicated. You're trying to figure out what's a confounding variable here, where are my regressions? It just gets really, really tricky. So it is oversimplistic, but I think we have a natural pull to have this false either or dichotomy that's created. I can tell you from a nature-nurture controversy or perspective in terms of, well, how much are things loaded in terms of genetics and heredity? How much are things loaded in terms of environmental variables, family situations, societal implications? On the mental health side, when we've looked at controlled randomized trials, and we look at identical twins raised together, raised apart, fraternal twins raised together, raised apart, siblings raised together, raised apart, and then individuals that have no genetic loading together, raised apart. With almost across the DSM-5, what you're seeing more often than not is about a 50-50 split there. So you do have to take into account that there tends to be a very strong bidirectional interaction between nature and nurture. So definitely a reciprocal process. And if you take just a one-dimensional approach, you really miss that beautiful integration that takes place. So my goal is to try to convince people from our talk today. One of my goals is to really think about, are you truly looking at things from this four-dimensional approach and process? Next slide, please. And I've already mentioned this, so we can actually skip this and go to the next slide. And what we were going to talk about there was that holistic model and integrating all four. This is a nice figure. As an educator, I understand that sometimes people do very well with listening, seeing written words, and some people do very well with visuals and graphs and figures. So I'm going to try to tap into all different learning styles here. With this one, it's just a nice way of looking at how these four come together and the interaction, where you would have the mental condition or the mental disorder in the center. From a biological dimension, you know, let's imagine we're looking at someone that's struggling with major depression, major depressive disorder, MDD, recurrent, severe, no psychotic features. That would be in the center. From a biological dimension, you're probably going to look at genetic loading, direct relatives that have a similar experience throughout their lives. Brain anatomy in terms of emotion regulation there, serotonin, norepinephrine, those implications. There's wonderful things coming out about polyvagal theory right now. So really much more looking at it from a neurological neurochemistry perspective. On the psychological side, personality, cognitive, emotions, learning. I mean, we have so many phenomenons here, from learned helplessness, and some of you might be familiar with that research. I mean, you put these dogs in a cage that's wired up, electrocuted. You electrocute the cage, they run around, you do that multiple times, they keep running around. It gets to the point where they just lay down and give up, and like, I've learned to just be helpless in this situation. You open the cage door, you electrocute it again. I mean, it's just so disheartening. But then the dog will actually not get up and leave the cage. It has learned this new way of moving through the world, even though their circumstances have changed. And we do that as human beings as well. And sometimes it makes us sitting longer in difficult conditions. Other cognitive patterns and emotions. So we want to look at negative self-talk, negative thinking patterns, reinforcers, secondary gains. There's so much there from a psychological dimension. Social dimension here are intimate life, our relationships with our families, our relationships with our friends, what kind of social support we have set up, our sense of belonging, love. So you can tell I'm kind of going up a little bit on Maslow's hierarchy of needs here. Our community, so much of that will either support your overall mental health or may make it quite challenging to maintain that. And then in a socio-cultural dimension, so maybe you're sitting there like, yes, I do this with my patients, but then sometimes we struggle to bring in this last piece because it can be quite sensitive, it can be quite controversial. The reality is, in terms of the society that we live in today, if you have a certain coloring to your skin, you have walking around day to day, you may experience more institutionalized racism, adding more stress to your system. From a psychoneural immunology perspective, you have this response that is compromising your immunity because you may be on a more constant stressful experience based on how the culture and the society is responding to you, based on your race, based on your gender. It's the reality of the world that we live in. It is a different experience to walk at a particular place at a particular time as a female identifying individual versus a male identifying individual. I could go on and on. Sexual orientation, religion, socioeconomic status, ethnicity, culture. And if I can make a plug, if we could all truly accept and love each other for who we are, as we are, we would be leaps and bounds ahead in terms of this mental health epidemic that we are experiencing. Next slide, please, as I get off my soapbox here. So a multipath model of mental disorders, really the idea here that no single perspective can explain the development of a mental disorder, that you really would need to take into account all four of these dimensions. And with that, it's one step ahead. But if you are willing to look at how all four of these dimensions are impacting mental health, then you would also be considering that from a treatment perspective, that you would look at all four of these dimensions. So instead of just telling people, you really need to change how you're thinking about this and your perspective on it, really tapping into that psychological aspect, you would also acknowledge some of the socio-cultural pieces going on, the family systems that they are involved in, and more on a biological mechanism. I think the beauty behind the biological side of this is many times we may go to and think about psychotropic medication, and that is one option. But if we're truly looking at it from a biological perspective, and that's tied to the discussion that will continue today, quite a bit of that is also tied into physical activity, exercise, nutrition, diet, sleep hygiene, all more natural ways of impacting that biological piece. So not all dimensions contribute equally, and really it's going to depend on the disorder, and it's going to depend on the individual and how those two interact. So I think it's beautiful to have this more integrative, open, basically everyone's included, everyone has a seat at the table model to mental health concerns. So it's an integrative, interactive, multipath model. The nice thing about this as well is it is a bit more, can be more of a strength-based model, because some individuals that you may treat or work with may struggle with this perspective that we must tackle this from this one angle. So meeting the patient a little bit more where they're at as well. Next slide, please. So this is sort of a spin, a positive psychology spin on the last slide, where instead of in the center having mental disorders, in the center now we're going to place resilience. Resilience being the ability to have a challenge in your life, a trauma in your life, not only manage it, rise above it, make meaning out of it, make purpose out of it in your life, having increased coping strategies, ways of managing your stress and the challenges that you face in life. So it's really quite a beautiful, meaningful piece in a way that you can look at it. So here we have examples on each of the four dimensions in terms of what this might look like. So from a biological dimension, being very mindful of what you are putting into your body, truly seeing your body as a temple to be honored and taken care of. And with that, educating patients on what are some of their vulnerabilities, maybe from a genetic loading standpoint. For example, if I have a patient that I'm working with and I'm well aware from a family history that I've done and throughout their intake that they have multiple, two significant others in their family, an aunt and a grandfather on the maternal side, one on the paternal side, that have both been diagnosed and met criteria for paranoid schizophrenia, I'm having a very serious conversation with them about their views and ideas around possibly using psychedelic drug experimentation and their possible uh, vulnerability related to that from a genetic loading standpoint. So looking at making some healthy choices on the biological side, and we've mentioned some of those: sleep hygiene, physical activity, nutrition, diet. On the psychological dimension, really looking at it sounds very cliche, but is the glass half empty or is it half full? And what is your view as you look outward? Are you able to, as things are kind of crashing and burning around you, have a moment to giggle and find the humor in that and make some meaning out of it? Mindfulness is a major key to this, because it gives you the ability to be in the here and now moment without focusing on the past, which can bring up significant feelings of depression, and without focusing too much on the future, which can bring up quite a bit of anxiety. So trying to be more in the present moment, having flexibility with the situation, in addition to having, hopefully some strong emotion regulation skills where we feel our feelings, we accept our feelings, but we may not be ruled by them. On the social dimension, trying to talk with your patients, clients, loved ones, friends, family, and yourself to be mindful of how much are you having that connection, that social support, surrounding yourself with people that honor and value your own lifestyle, the way that you move through the world, that these are individuals in your life who even exemplify things that you hope to integrate into your life. When I was working in residential treatment programs, before someone would discharge, one of the major things we'd have to talk to them about is the research that is out there to state that if you want to make any major change in your life, one of the most predictive variables that you would first change is actually your social support system and surrounding yourself with individuals who are doing what you are hoping to do in your life. So you can imagine what a major loss that is for someone, for example, that now wants to reduce their alcohol use or abstain, but their entire social support system is based around people who are heavy alcohol users. And then I already mentioned about the social cultural dimension, but being able to live in a world that is supporting all the different variables that make us who we are and our identity. So the integration of that, and maybe as an individual, yes, there may be avenues where there can be an influence there, but sometimes just an acknowledgement of the challenges is very powerful. Next slide, please. So Dr. Khamba and I, we're getting excited. We're starting to talk about, what do you think from, your area of expertise, my area of expertise? Like, it'd be amazing to look at this possible idea of probiotics and the impact it has on mental health. And I'm starting to get anxious because I'm like, oh gosh, like within my world, it would be seen as so like fringe pseudoscience, and hers as well, that you would put these two pieces together. So this is before 2018, and we're having these ideas and we're going back and forth. And then this is the cover story that comes out for the American Psychological Association. Literally, the cover story is the possible future of looking at the microbiome and how that can also impact an individual's mental health. And we're like, we're at the right place at the right time. And I do think it's truly wonderful, because if you were to ask, when I was first working in the field in the late 90s, and if I was bringing up like this mind-body connection and let's, work on this from these different angles, I would probably get laughed out of some rooms. Where now, this is very common language. People seem much more open to it. And it's a really exciting time that we're seeing more investment in this idea that with any condition, to really look at the human as a very complex system that is multifaceted, and with that regard, targeting different angles when we are treating and healing an individual. And with the next slide, I think I'm turning it over to my colleague here, Dr. Khamba.
Thank you. So, as Dr. Shuttleworth mentioned, so we're both, we're eagerly excited. This topic of the psychobiotics or of this gut-brain connection started coming up in both of our worlds. And we decided, we wanted to take this a step further and look into running, potentially getting a study going. And that's sort of the next step of what we want to do. So what I'm going to be doing is I'm going to be describing some of the natural supplement side of things, and as well as I'll be integrating that into a study that we're going to be launching here, that we're wanting to launch, and seeing if you'd be interested in participating. We're always looking for people in integrative clinics who, as the study gets going, to participate in as well. So with that, what I'll do is I'll go into a little bit about complementary health products and how it works. And then, so as Dr. Shuttleworth describes some of the mental wellness and the mental health side of things, I'll start to describe some of the complementary medicine side of things. So when it comes to these complementary health products, we're looking at them as to identifying any of the approach when it comes to using anything, including anything from Ayurveda to biofeedback, whether it's diets or supplements, naturopathic medicine, or like in our case in particular, non-vitamin, non-mineral dietary supplements, such as probiotics in our case. And the reason that we're looking at this, and the reason it's, this idea is really coming up from an integrative medicine standpoint, is the realization that we're looking at the rates of complementary health users within the US, and we're noticing that almost a quarter of adults over the age of 18 are using some sort of complementary health. And we saw that list of what that entails. So you've got a high number of people who are using it. And now what's particularly of interest is that while between 2007 to 2012, there hasn't been any change in that percentage of people who are using these using these non-vitamin, non-mineral dietary supplements. However, what we are noticing is that there is variability within the specific supplement that's being used over the last 30-day period of time. So while we're still remaining high in the people that are using supplements, the types of supplements that they're using have changed. And so what we've noticed is that 1.6%, so this is looking at back in 2012, the use of probiotics or prebiotics by adults was 4 times higher than that from 2007. So we're noticing that now in 2012, there's nearly 3 million more adults using probiotics or prebiotics in 2012 than in 2007. So we're noticing that really high number of people are starting to use these probiotics and prebiotics. And they're coming up in a number of different areas because we're seeing the benefit. It's not just something that's good for gut health, while it's wonderful there, but we're noticing the connections for it from an immune perspective, from a mental wellness perspective, from a variety of different areas that we're starting to look at. So it's really gained a lot of interest, and we've really come to value what probiotics can do for us. So why do we include probiotics? So people are using them for a number of different reasons. Like we mentioned, they're using them to improve their overall health and well-being, as well as to relieve symptoms of any sort of chronic disease that they may have, to aid with side effects of conventional medications. And it's most often used to complement conventional care rather than to replace it, and as well as to increase knowledge about various types of health products, natural health products. So what we're seeing overall based on that is that people are wanting to use probiotics because they're seeing that it does, from even a general health standpoint, just as many people would consider taking a vitamin, they're adding a probiotic to that picture. So probiotics seem to be one that people are needing to add in for overall general health and well-being. Also, people who have any sort of chronic diseases, not just necessarily geared toward digestive diseases, but anyone who might have ongoing chronic diseases will seek to have benefit from probiotics. Like, for example, people who have, say, diabetes. It also aids with the side effects of conventional medication. Many of the conventional medications that are used out there often have some sort of maybe potential digestive concerns or skin issues or any of those sort of things. And the use of probiotics seems to be quite beneficial. I remember I worked on, I was in a clinic once, in a psychiatric clinic that I was working in, and we had run a study looking at the use of probiotics with patients who had fibromyalgia, and we were using it particularly in patients who were taking an SSRI at the time, and we were giving the probiotics to them to help with the digestive complaints that they were having with their SSRIs. And so, and we noticed a good benefit from there too. So those are, things that we can notice. And there's many other instances where probiotics prove to be beneficial to the side effects of medication. It's not just something that we replenish after an antibiotic use, but in many other instances as well. Also, like mentioned, it often can complement conventional care. So it's not, and when we say conventional care, we mean, for example, with pharmaceuticals. If pharmaceuticals are being used, well, it's something that can easily complement a lot of it for a number of reasons, not just the digestive health, but as well to improve sort of the patient's overall care, well-being, and how they may be feeling. So nowadays, our healthcare consumers with internet, with knowledge and books and interest, seem to have a lot more interest and knowledge towards natural health products. And that also pairs, in fact, with, when we're looking at North American culture, the majority of us here, within the last couple generations, have come from another country. And typically what happens is in countries outside of North America in particular, there's a high use of traditional forms of medicine, about 80%. So if you go into other countries, you'll see, particularly when we're looking at developing countries, in developing countries, about 80% of the medicine that's being used is used from a traditional medicine standpoint. Now you come here and that's flipped a little bit, where 20% of the medication or 20% of the medicine that we're doing is largely based on conventional, but we come from this historical background of having traditional medicine, both the indigenous cultures here, as well as from those of us who come from some developing countries or have that history of it, where we're bringing some of that knowledge. And so people are coming in with these ideas and knowledge around natural health products, natural health practices, or conventional medicine practices, and integrating it into the conventional medicine that they're receiving. So we'll focus a little bit on those who have chronic diseases, because those, like we mentioned, seem to be the ones who have the highest use of complementary health products. They're the ones that, in addition to whatever conventional medications they're on or potentially not on, they're looking at complementary health products to use as well with what's going on. Now, interestingly, some of the most commonly reported reasons for taking natural health products are for anxiety, depression, and chronic pain. So just as Dr. Shuttleworth indicated the high cost that that mental health is having on the nation or on North America, we can also further take a look and see at how that ties closely with people who are also searching for alternatives or other reasons for things that are other health solutions. So that's where complementary and natural health products really come in. So complementary therapies are used more often than conventional therapies for those with anxiety attacks and severe depression. So people are going to be using these natural health products, so we might as well make sure that we're using beneficial ones that can be of true benefit for them. Okay, so when we talk about probiotics, there's so many things that are of benefit. And I know some of the people, I've had patients ask me, well, is the probiotics I get out of my yogurt, going to be something that's of benefit, or if if I take a kefir or something like that. And those are beneficial, agreed, it's a good fermented product to get it, but you're not going to get the same dosage as what you're going to get from a capsule. And in this case, because we're trying to incorporate a high amount to treat therapeutically, we usually try to get high doses. And I didn't mean in like we're looking in the billions here. Whereas what you're going to get out of, a standard cup of yogurt isn't going to cut it, nor will you have all the multitude of strains that you're going to be looking for. So when it comes to probiotics, we know that the gut bacteria actually does help, the production of our neurotransmitters. And so the bacteria have been helpful. So the bacteria that we find in the gut are helpful in producing things like GABA and serotonin. And that's why we have that entire gut-brain connection, where you have a gut feeling about something, or any of those sort of expressions that you can use. But those expressions do come from somewhere, and we can see that in this case, they're coming from the idea that there's this connection between the gut and the brain. So the exact mechanism is unknown, but we know that, however, disruptions are associated with anxiety and depressive disorders. So we can see this connection between a disruptive gut bacteria, or disruptive gut bacteria, and how it influences a person's mental well-being. So when we talk about disruptions, what we mean are things like cesarean births, being bottle-fed, early repetitive antibiotic use, as well as alterations in stress activity. All those really, and you can see a lot of these are early instances that occur. So early childhood instances early lifetime instances that are occurring that really cause that major disruption of gut bacteria to cause some of that stress reactivity and disruption to the way that our gut flora is going to be creating some of those neurotransmitters. So when it comes to our clinical trial that we hope to do, I'm going to guide you through some of our clinical trial and what we aim to work on, and hopefully if any of you are interested in your clinics to potentially share. And we're going to run it through 2 phases. And we're hoping that if you're interested, that you might want to work with us during our second phase. So the question that we seek to answer is, how can probiotics influence mood, focus, sleep, and overall health? So as Dr. Shuttleworth and I have been talking about, we've been seeing these connections. We've been noticing the literature is reporting on connections, as we've discussed, between these 2 areas. Well, now we want to actually get some good work out there and utilize all of our wonderful integrative practitioners who have an interest in this to as well use it. So what we want to do is to investigate the effects of probiotics on anxiety, depression, and associated physiological and psychological factors in humans. So our study population right now, so we're looking at Bastyr University Clinic here. At Bastyr University, we are a teaching clinic, and here at the clinic we have patients coming of all ages and demographics, who will see the students here. And we have a main focus on integrative primary care. We're an accredited school and a School of Naturopathic Medicine, Nutrition, Counseling, Psychology, and so on. And we're also hoping, like I said, to operate the study out of whatever private clinics would be of interest in doing this sort of work with us. So like I said, we're going to run it in 2 phases. The first phase is going to be a pilot study. And in this case, what we'll be doing is we'll be recruiting the patients to be coming in from the supervising naturopathic doctor, likely me, at Bastyr University Clinic. And what will happen is that we'll have adults over the age of 18 who are coming to the Bastyr University clinic here. And they haven't had any change in their medication or natural health products over the last month. And then we'll be incorporating the use of a probiotic. And we have a particular probiotic that we're working with. We've got a company who's happy to work with us and supply us with both a probiotic as well as placebo. And so then we hope to do a multi-center trial with Bastyr University Clinic, as well as any participating private clinics like yourselves. So our intervention, we're going to be using, we're working with Vitazan, who will be giving us a multi-strain probiotic that we hope to use. And so we're going to be working together with them. So the study design that we aim to do is going to be a 12-week investigational randomized controlled trial, a crossover pilot study that we're going to do first, basically to use it as a proof of concept. So we'll do that first once we've sort of etched out a plan and worked out any kinks or anything that needs developing in that area. What we'll do is we'll further follow it up by another 12-week multi-center trial. We hope to do this work with this within patients within Bastyr University Clinic who are currently seeking care. Our sample size for our pilot is going to be 5 patients, where our sample size for the multi-center will hopefully be about 100. Will be 100 patients, but we're happy to take on more. And so the outcomes that we're going to be looking at are going to be some of the depression and anxiety scales, the anxiety scales, and some quality of life scales, as well as looking at biological markers through stool and blood potentially as well. So for our study design, so we have phase 1, which is the pilot study, phase 2, which is the multi-center study. So for both phase 1 and phase 2, there's going to be 2 periods. And what you're going to see is the study participants are going to come in. So for the pilot study, our proof of concept is what we're going to be doing here. So we're having a sample size of 5. And in this case, the study participants are going to be given the scales and markers that we had indicated. They'll be initially broken up for 4 weeks into treatment group A, which will be the probiotic, and treatment group B, which will be the placebo. After 4 weeks, we'll have a 4-week washout period. After the 4 weeks are done, we'll have another 4 weeks where they're going to switch over. So we're going to cross over. So those who had the probiotic will now get the placebo. And those who had the placebo at this point will get the probiotic. Now the participants are going to be blinded, so they won't know what they've received one way or the other. And this will help by doing it first this way, by doing it at a pilot study. We can do this so that we can incorporate a proof of concept to make sure that we've worked out any of the details that need changing. Then we'll refine it for whatever scales or measurements or things need refining, and then we'll get into the larger multi-center. So we hope to use it within Bastyr University Clinic, private clinics, whoever is able to participate and shows an interest, and then to go through the same process again. So we'll divide up the patients as they come in. Some will be in treatment in group A, some will be in treatment group B, and then there'll be a washout period again. So 4 weeks that they'll be taking the supplements, 4 weeks that they'll be washing out, and then 4 weeks will they be on the next one. And so that'll give us the 12 weeks altogether, and then we can see what's going on. So our inclusion criteria that we hope to do is going to be, otherwise healthy patients who are coming in, and as long as they don't have they're not having one or more currently diagnosed conditions of the ones that we've listed here. And so our primary outcome measures, what we're hoping to see, because we're particularly interested in how it's going to influence mood. So we want to run through some of these scales to see what's going to be going on. And we're going to run them at different times. So at time 0 at baseline, and then at week 4, week 8, and week 12 to see how patients how their moods have changed over different periods of time. And so the procedure, the way that we intend to do this is that patients at the Bastyr University Clinic will be informed about the study regarding the probiotic. Interest in the participation and receiving probiotic as part of their health treatments will be sent to the investigator. And then once we get confirmation, then we'll go through and start to obtain their information. Patients will be given the supply for the probiotics or the placebo, so that they'll be given everything, and then they'll know what to do from there. And then the questionnaires will be emailed to them during those periods of times that we've indicated. So the risks and the reasons that we're doing this is that probiotics, are good bacteria that can grow naturally within the human gut. And as I mentioned, if we have these early life stressors that have caused disruption bacteria, and how many people, are bottle fed or have these cesarean births, and it's not just those ones, but there's also, other frequent things throughout the years that could cause a disruption to one's gut bacteria, whether it's a severe illness, whatever could be going on, or certain medication use, and all those things that come to play. And we know that that bacteria is also supposed to be, that bacteria is contributing to the development of the neurotransmitters, well, now we're going to see a potential worsening of someone who has, conditions such as depression or anxiety or any of the other mental wellness concerns, any mood disorders that we might be concerned about. So we know that, and this is a good fit because there's no published risks that are necessarily associated with probiotic consumption. And participants will be likely contacted twice during the first week just to make sure that they're not experiencing any side effects. And while the direct benefits are uncertain at this point, it's possible that they may experience a reduction in anxiety and or depressive symptoms, and as well as a reduction in physiological bowel-related symptoms. So this is what we're hoping to see and theorize to see, and as well as what we've seen in the literature so far, is that this is the direction that we hope to see the same sort of benefits. So at this point, IRB is pending, and we're hoping to start in September to get this sort of thing going. So here are both Dr. Shuttleworth and my email addresses, should you be interested. And I know that we've also provided for you our slides, so that should you have any questions about the content or you're interested in discussing any further details with us, we'd love to hear from you. And those are references. I'll put this slide up and I'll just see if we have any, are there any questions? Let me see here.
Thank you so much. First of all, that was a lot of really great information. And yes, we need research happening. So thank you so much for that call out. I see one question actually, and you did touch on this, but I think we can circle back to it, where for those who want to stick with yogurt and kefir, are there some strains to avoid and some strains that are more beneficial? And then maybe we can talk about, with probiotics, which supplements do you think have good quality control for the live count?
Yeah, so when it comes to kefir or yogurts or anything fermented, those are excellent ways to get prebiotics, which will help nourish our probiotics and our current gut bacteria. And those are always great to have as far as maintenance or everyday life is concerned. Of course, unless you have other concerns going on like SIBO or anything else, which it might cause things to worsen. But those will be good. But from a mental wellness perspective, I don't know if just sticking to those would be enough because the strains wouldn't be high enough. But for everyday sort of eating, you can definitely just have, I encourage people to have all those fermented foods just in your everyday life in general. And as far as which supplements would have good quality control for live count, what I usually try to aim for is any of the ones that when you're looking at them, when you're looking at the list of what's on the back of the bacteria, making sure there's multiple strains. You want the Acidophilus, Bifidobacterium, those are your main ones. And as long as there are a good number of strains within those, and having them dosed, like depending on what's going on, you'll see dose ranges from say 5 billion to 20, 50, 100 billion. And those strains really depend on what's going on within the person. A person who's had, say, has been on antibiotics might need a higher strain for a short period of time. That's again, that wide spectrum versus maybe somebody who has maybe some autoimmune concerns might need a lower dosing because if there's nothing active going on. So there's a full spectrum of what you could be doing with them. It just depends on what the rationale and what the reasoning for it is. So that's
Excellent.
that one.
And there is another question in the chat, and it says about any chance, would you be interested in working with the federal government, maybe specifically the Veterans Health Administration for your trial? And, it sounds like there's other interest and people are very excited about the study progressing. But what do you think about this study with Veterans Health?
I think that would be fantastic. And yes, absolutely. I mean, Dr. Shuttleworth, maybe I don't want to keep cutting in, but if you want to add to that.
Yeah, I think absolutely. And we've done this talk before, for example, at the Scripps Natural Supplements conference, and you would be amazed. It was a nice combination, mostly I'd say medical providers. And I think a lot of us are really wanting to see this research progress. I think what people are really motivated by is some of the work that's been done in this area is very correlational, but we really have not been able to see the randomized controlled studies. And we would love to keep it moving forward. It hasn't received, as far as I know, Dr. Khamba, but to date, I don't believe that probiotics have received FDA approval where we can make any statements about the impact on mental health concerns. So that's really where we're coming from, is to be able to move closer in that direction. But yeah, I think as far reaching the veterans piece, I think that's huge. It is truly a group of silent sufferers who, are put in very traumatizing situations, asked to live their lives in a completely different way from how we do in society. And then there's minimal reintegration that happens when they come back to their homes. And the reason I'm mentioning this is there can be quite a bit of stigma around mental health treatment within that community. If we find evidence to support that probiotics do in some way help to manage mood regulation, this would be an option, a treatment option that is less stigmatizing, has increased accessibility, and individuals may be more open to integrating into their overall approach to health. So I think there's a ton of potential there.
Absolutely. And I'll add to that in that when we're looking at, so I talked about some of those big stressors as being disruptors to gut bacteria. Post-traumatic stress disorder is a huge one. And, with many of the veterans coming in with that PTSD picture, they have massive disruptions to their gut bacteria that would prove beneficial. So this would be a great way to get some much needed help for them.
Yeah, and when I do outreach or work within that community, the official DSM diagnosis is post-traumatic stress disorder, PTSD. Within that community, we don't even call it that. We call it post-traumatic stress injury, because that feels more doable for how they've been, socialized and trained psychologically, where they can accept that more than it being a disorder, but an injury, which connects more to, for example, a physical injury in their minds.
Yeah, thank you for clarifying that distinction. Wonderful. I'm not seeing other questions right now, but I think this was so exciting. And again, as you can see, that's still up on the screen. We encourage you to reach out. Here's another question. When you focus on probiotics, do you find patients who are willing to take this may also be willing to do better with their diet? Is that something else you find is connected?
I'll answer that one. So when it comes to probiotics and when it comes to sort of the levels of care that we'll give. So what I'll first like to do is I like to work on a foundational perspective. So first I will work on a patient's diet to see what's happening there and try to improve their gut, improve their diet overall, if that's something that needs addressing. And in addition to that, then as we sort of progress from there, then I'll also add in the probiotics too, because we want the probiotics to be of benefit as well. And then, like we discussed with the other stuff of like yogurts and, kefirs and kimchis and all the other wonderful fermented things out there. Those can all sort of play a role within there too.
Yes, shout out to pickles.
Yes.
Absolutely. That's great. Well, thank you so much for taking the time to come and share this really important work and preparing for the study. We're excited to see the results, and this is the work that we need to have research showing the benefits so that we can make the claims that this is something that's beneficial and find out the truth, right? So thank you so very much to both of you for joining us today. I'm just going to quickly share a couple last slides here as we come to a close. Thank you to everyone who joined us as well. We love our community so much. And remember, you can continue to get free expert webinars and resources from us. You can sign up for our emailing list and visit our events page to find out about upcoming webinars, as well as get involved in our local chapters and student alliances as well. And we also like to say, last week we celebrated our cohort 6 spring 2021 AIHM fellowship graduation, and we had a ceremony. And if you missed it, you're welcome to go to our YouTube channel and see it. There's just so much love with our fellows who just recently graduated. So I like to let everyone know that that's available to watch. And mentioning that, we have our next cohort starting in October, this October, and the online application is open, and we're now enrolling fellows. If you're interested in learning about integrative health and medicine, this is a great way to start. We've got our Director of Admissions, April Grzinski, which would be glad to speak with anyone who has any questions. And as always, stay connected. We welcome all of you in our community. You can become a member if you're not already, get involved in a chapter or a student alliance, and you can find us on all these social media platforms. And yes, just another big thank you to our guests today, and we hope you all have a wonderful weekend. Bye.